Hello everyone. This class we will talk about the contents of atherosclerosis. I'm from Department of Cardiovascular Medicine, the first hospital of China Medical University. Part 1. The concept. As we know, the atherosclerosis remains the major cause of death and premature disability in developed societies. As for the concept of atherosclerosis, is a pathological change including the common characteristics: thick and stiff arterial wall, loss of elasticity, and lumen stenosis, and it includes the three types: atherosclerosis, arterial sclerosis of small artery, and Meckelberry arterial sclerosis. And among the three types, the atherosclerosis is the most common cause of arterial sclerosis. It usually begins from affected arterial edema, causing many pathological changes, such as local accumulation of lipoprotein, proliferation of fibrous tissues, and the disposition of calcium, regression of arterial media, and some secondary change, including rupture, bleeding, and thrombus of plaque. And this picture demonstrates the three kinds of arterial sclerosis, and the left one is the most common and typical ones. Is atherosclerosis. We can find the plaque in the artery. Part 2. Risk factors for atherosclerosis. There are several risk factors for atherosclerosis, such as age, old age, and male sex. And these two risk factors are unmodifiable, and the others can be modified, including dyslipidemia, and this is the major ones, including high LDL cholesterol and lower HDL cholesterol. Among these, LDL cholesterol is also called a bad risk factor, and HDL cholesterol is a protecting factor, also called a good factor. Others, such as hypertension, smoking, diabetes mellitus, and the arts, and so on. From this picture, we can find that the LDL adds the cholesterol to the plaque, so it's called a bad one. And HDL removes the cholesterol from the plaque, so it's called a good one. Part 3. Mechanism and pathophysiology. From this picture, the left one is a normal lumen of artery, and the right one, we can find the plaque in the edema. But how the process from the left to the right? Now let's look at the mechanism. There are several theories exploring for the process of atherosclerosis, such as lipoprotein infiltration theory, thrombus formation theory, and the smooth muscle cell cloning theory, and the most important one is the endothelium response to injury theory. And this theory is the newest and commonly accepted one. In this theory, all the risk factors finally cause the injury of arterial endothelium. And the formation of atherosclerotic layer is the inflammation, fibrous proliferation response of the artery to the injury of arterial endothelium. This picture shows the process of atherosclerosis. In this picture, we can find the foam cells in the plaque, and it's the key process for the formation of atherosclerosis by this theory. Part 4, Stages and Manifestation. Let's look at the process and the stage of atherosclerosis. And this contains the stages of atherosclerosis is coded by the AHA guidelines, including the following 6 aspects. The first one is fatty support. In this stage, we can find the formal cell formation only. The second one is fatty streak. We can find the yellow streak on the endothelium. The third one is pre-plaque. We can find extracellular fatty streak, but no lipid core. The fourth is atherosclerotic plaque. We can find more lipid and lipid core formation in this stage. The fifth, we can find the fibrous atherosclerotic plaque. And this stage is the characteristic one. Atherosclerotic plaque lipid core embodied in fibrosis. The last one is a complicated plaque. We can find a serial type such as rupture, bleeding, and thrombosis. This picture shows the 6 consecutive stages of the plaque. We should pay attention to that. The first stages usually have no symptoms, but the last 2 we can find the clinical events. For the clinical stage and the manifestation of atherosclerosis, usually we summarize it into 4 consecutive stages, but maybe alternately or simultaneously. The first one is asymptomatic. The second one is ischemic stage. Usually we can find the symptoms after ischemia, such as angina pectoris or TIA. The third one is the necrotic. The last one is the fibrosis stage. We can find the fibrosis during repairing, such as heart failure or strophe. Okay, part 5, prevention and treatment. This part is the most important part. The first one, non-drug treatment and prevention. In this part, the most important one is the control of risk factors, including rational diet, proper physiology, activity, and balance of work and life, weight control, smoking cessation, drinking limitation, treatment of hypertension, diabetes, dyslipidemia, and so on. The second one, drugs, including the following 3 aspects. The first one is blood vessel dilation medicine. The second one is lipid-lowering medicine. And the third one is anti-plant drugs. I think the last 2 is the most important. In the lipid-lowering medicine, the statins is the commonly used one drug. It can mainly reduce cholesterol, especially for LDL cholesterol. Third one, interventional operation and surgery. For the stenosis of obstruction of the arteries, operation including intervention and surgery may rescue the blood supply of myocardium. The left picture shows the process of stent, and the right one shows the bypass. Okay, that's all. Thank you very much for your attention.